Mr. Chairman, and thank you, Mr. Cohen, for your time today. I, too, received my insurance cancellation. Have you ever met anybody who had their insurance canceled?
You may be the first.
That's pretty shocking because 335,000 people in Colorado alone had their insurance canceled. The letter that I got that told me that it'd be canceled included this option. Your option includes purchasing another individual health plan from us, purchasing a health plan from another carrier, or purchasing a new plan through Connect for Health Colorado. Was the President's promise that I could keep my health care plan upheld? The President's promise to me, was that upheld?
Well, I mean, we've talked about this a lot. The law provided that insurance companies could keep the existing plans as long as they didn't make significant changes to benefits and cost sharing. Insurance companies made different choices. There are still a lot of grandfather plans out there, and those maintained. But then there were other plans that did not continue into 2014. So in some cases, those plans were canceled.
And so was the President's promise upheld to me? I mean, I don't remember the President saying there's qualifications if you like your health care plan. There's no asterisk.
The law made it possible. The law made it possible for everyone who was in an existing plan as of the time it was passed for that plan to be maintained, but it didn't require insurance companies to continue offering them. So what we did in November was we offered another opportunity to say to insurance companies, you can keep those plans in place even if they didn't meet the requirements of the grandfathering provision.
So these changes to allow that these are big changes that you'd have to go, or would a $5 change require them to discontinue the plan?
There was a percentage change that was in the regulation as to how much, and it wasn't a change in premium, it was a change in benefits or cost sharing.
So a copay of $5, that would require you to lose your insurance then?
I think that was one of the requirements.
And so is that a significant change to an insurance policy in your opinion?
Well, if a copay was $20 and it goes up $5, that's pretty significant, yeah.
So the President's promise, so really in your mind, he shouldn't have even had to apologize because he didn't do anything wrong.
I think the President said that he recognized that what he had said did not prove to be true for many Americans. And as a result of that, we offered another transitional policy to make it be more possible for more Americans
and
to keep their plans.
Do you have legal opinions that give the President the authority to make these extensions and changes? Could you provide me with the legal memorandums?
I'd have to go back. I honestly don't recall whether we had a legal opinion on that particular issue.
When did you testified in September, as we've talked about before, the committee talking about everything going fine and it would be fine. When did you first know that it wasn't going fine? Was it September 27th, 28th, October 1st?
October 1st.
So you had no indication prior to October 1st that things weren't going well?
I had no indication, but prior to October 1st, that we were going to have the major problems with the website that we ended up having.
When did you first know that people would have their insurance canceled?
I think we've always known that not all of the grandfather plans were going to continue. I don't think we had necessarily a sense of how many would and how many wouldn't.
When do you expect small business plans to start canceling insurance?
That will likely happen throughout the course of the year. Small business plans don't tend to all come up for renewal in January. Many of them were renewed early in 2013 so that they will continue.
And how many do you anticipate being canceled?
I don't have a number of that. We can look to see if we can come up with a number.
If you could provide an estimation of how many additional insured you think will be canceled, that would be great. And so do we have an idea of how many signed up through the federal exchange so far? I know some of this we've talked about before, but how many people have signed up through the federal exchange?
Well, we reported that as through December 28th, it was 2.2 million in the federal and the state, and of those, it was something over 1.1 million were in the federal.
Okay, so about 1.1 million in federal, 1.1 million in states?
Roughly, yeah.
Okay. How many of those who signed up in exchanges were not previously insured?
And I don't have that number.
How many were previously insured but had their insurance canceled and now signed up in the federal exchange?
I don't have that number either.
How many saw their insurance rates go up?
I don't have that number.
But you said that you know of a significant number of people who saw the rates go down.
As we've been hearing,
so you don't know for sure if their rates went down. You're hearing anecdotal evidence.
We're hearing anecdotally, and I think
so
that
we don't have any concrete numbers on whether rates went up or down. As in the government.
I think that we know that for people who are eligible for a subsidy, that you know, for those people, it is, you know, almost certain that their costs would have gone down.
So you have some numbers, but you don't know how many went up. Okay. So of the supposed 45 million without insurance, how many people now have insurance?
I don't think we have that number yet, but certainly we're going to try to come up with as good data as we can as we go forward, you know, through to the end of open
How do we
enrollment.
know the law is working?
Well, we know the law is working for many people, and we know that.
But you don't know how many of the uninsured are now insured. You don't know how many people saw the rates go up versus rates go down. Insurance companies aren't being paid yet. Let's talk about the risk corridor provisions. What is the probability of the risk corridor provision being utilized or activated?
Utilized.
What is the probability of the risk corridor language being utilized?
Oh, I mean, I think there will be a risk corridor program.
No, but I mean, what is the provision of that language being activated and payments being made from the government to insurance companies? What's the probability of that?
Oh, that will happen.
So you're saying that the government will be paying private insurance companies?
Oh, how likely it is that there will be that there will be claims on the program?
Yes.
I think we anticipate that there will be claims on the program, but